Hello, and thank you for joining us for our newest series, Katz Conversations, where we take a deeper dive in getting to know our women's health experts on a personal level and explore their passion and their career trajectory. My name is Sharon Zarabi. I'm one of the program directors at the Katz Institute for Women's Health. And today I have the honor of sharing the stage with Dr. Neil Tanna. Dr. Tanna, I'm going to have to look at my script just to go over all of your accolades and credentials. So not only are you a surgeon, but the investigator with the Institute of Bioelectronic Medicine with the Feinstein Institutes for Medical Research. You are a professor of surgery at Donald and Barbara Zucker School of Medicine, and you are a fellow colleague as the vice president with the Katz Institute for Women's Health Surgical Center. So that presents the stage pretty well. So thank you for joining us.
Sharon, thank you. And thank you to the Katz Institute for Women's Health for having me. I'm excited.
Yeah, we're excited to get to know you outside of the surgeon stage. So tell me a little bit, what attracted you into this field of plastic surgery, I guess even breast reconstruction surgery to be more specific?
Yeah, it's a sort of a series of, fortunate events. I fell in love with plastic surgery first. I love the concept of art and science, and that's really what plastic surgery is. It's really trying to apply principles and match what a patient wants. And you look at that, whether it's aesthetic procedures or reconstructive procedures, it really is trying to figure out an operation that's going to be unique to that patient, right? And that patient's preferences. What bothers one person may not bother another. And within plastic surgery, the field of breast reconstruction blew me away, right? We see these women who are getting mastectomies, and everywhere you look, it's rampant. And so breast reconstruction is a field where you're able to apply a lot of the reconstructive principles to, match aesthetic preferences. And then at the end of the day, you and that patient are able to visibly see what the effect is. And that has an emotional component, both for the surgeon and the patient. Sometimes it can be positive and sometimes it can be difficult, for a patient. But what is rewarding, I think, for any KIWH member is to be a part of that journey, right? It's an honor to be a part of that journey. And the patient, because the result is right there, they invite you to be a part of that journey. And that's an honor unlike anything else.
Okay, so you must have read my mind because my next question was actually, what is the most rewarding part of the work that you do? And I guess let me even flip that coin and ask you, what's the most challenging experience that you have in your field?
For a lot of our procedures within breast reconstruction, within plastic surgery, within GYN surgery, I think a lot of our colleagues in the KIWH would say that there is an emotional component to surgery, right? And there's a physical component to surgery. So you look at two women, let's say, one who's undergoing a joint replacement and another that's undergoing a mastectomy with reconstruction. Both are going to have a physical component. But I would argue that probably the woman who's having a mastectomy and reconstruction, or even, let's say, a GYN procedure like an oophorectomy, there is an emotional component there as well. Right? There is a loss of femininity. The woman could undergo menopause, and that can translate into even interpersonal relationships. And so what is challenging and probably rewarding at the same point is that when we are taking care of these women, we're not just focused on how's your pain, how are your incisions healing? Do you have any surgical complications? No, we're also, how are you feeling? How are you doing? And if you probe those questions, you sometimes get answers that are challenging. I don't feel like myself, or my clothing doesn't fit, or how do I tell my daughter? How do I be intimate with my husband? How do I go to work, right? So there is an emotional component to what we do, myself as a plastic surgeon or a breast reconstruction specialist, but certainly beyond that, all of our Katz members, where we are not just taking care of a body part or a physical ailment, we're actually taking care of someone's entire self or spirit or emotional well-being. And that's the challenge, is taking care of both.
Yeah. So it's funny. I mean, obviously, we're both in the field of health and wellness, and I always talk about the 6 pillars of health and wellness. So you got your physical component, you got the spiritual component, you got the intellectual, the mental, the physical on top of that. So it all comes together. And it's interesting because most surgeons, like to go into surgery because they just don't like to talk with patients. They just want to operate, right, and do their skill. And you're really looking at your patients as a whole person. So it's beautiful. And I think that's really what we pride ourselves on at the Katz Institute with women's health experts, just like yourself.
And it's true. The Katz Institute for Women's Health does that. I mean, they look at the entire woman. And that's why even if you see every surgeon or every clinician is offered training in integrative medicine, training in health and wellness, training in lifestyle medicine, it's all one thing, right? It's making sure that, yes, you take care of your disorder or your organ or your, disease state, but really at the end of the day, how is that woman? Have you taken care of her? Is she happy? Is she okay? Right? That's really the outcome measure that matters at the end of the day, is the satisfaction of the patient.
We aim to please. So being in the field of surgery, I mean, we have a ton of viewers sitting here today and you have the stage. So let's take this opportunity to ask, what's one thing patients should know about your field, or what is a misconception in the field of plastic surgery?
Yeah, plastic surgery is it's a specialty that is provocative, it's sensational, and for those that don't know it, at superficial glance, you could think of shows like Botched or Dr. 90210 or Extreme Makeover. It's sometimes misunderstood. There is absolutely an element of aesthetic surgery and aesthetic improvement, but that's not where we stop. Right. And not to discount that is huge, right? We all want to feel good, look good, be our best selves. But there is an entire aspect of plastic surgery that has an incredible impact on people's lives. When you look at breast reconstruction as an example, that's one aspect, right? And plastic surgery is the same specialty that does face transplants, right? And these are the most intensive surgeries. And you take a veteran whose face was, mauled by a landmine, and there's really nothing else left. That's plastic surgery, a face transplant, right? And if someone were to cut their finger off and you have to put that back on, that's plastic surgery. And it's the same field that's looking at, doing 3D printing for organs. And it's the same field, right, that's looking at an amputee and how do you create an innervated limb? So if your mind thinks that your body follows, right? So plastic surgery is so much more than skin, surface level, Botox, right? That's a lot of what people think. And it's so much more than that. And that's what I hope our viewers and our colleagues and anyone who's listening understands, that it's an incredible field and it has power to really change someone's life, both in an aesthetic and reconstructive sense.
Yeah, no, 100%. It's not just aesthetics, it's also functional.
Correct.
I mean, you're giving people a second chance to life, right? It's revival almost.
Right. No, absolutely. There's just so much more to it.
Yeah, and you talk about all these advancements even in the field of surgery. What is, one of the biggest things coming down your horizon right now?
Yeah, I think, there's definitely an impetus and a focus on minimally invasive surgery, focusing on recovery, focusing on scars, focusing on getting women back to work quicker, back to their home life. Yeah. It's hard to tell an active woman who's got children or an active life or who's professionally very busy to say, hey, take 4 weeks out of your life. So there's definitely using technology like robotic surgery, artificial intelligence, to really find ways to make the same surgery less invasive. I think that's really where technology is going to make the most. And then the other aspect is that, anxiety comes from not knowing, right? I've been a patient. I'm sure you've been a patient, and our viewers out there have been patients, right? So
the fear of the unknown.
Yeah, exactly, right? And it's the fear of the unknown. And it's like, even if my dentist says, oh, you got to go see an endodontist, I'm like, what does that mean? Like, what are they going to do, right? And I'm scared. I'm sitting there like researching it. And that's because we have to do a better job of educating to our patients. So technology is going to do a better job at helping our patients kind of understand what we do and what they can expect. What are all the possible outcomes? I think that that's sort of the next thing in our field, is to really be able for a woman to fully grasp and understand what are the possible outcomes, so that it may not make it easier, but it'll definitely make it less nerve-wracking.
Yeah, and I think that's so much of what we do at the Katz Institute for Women's Health, is that we empower women to understand their choices and to increase their awareness of what are, these trending possibilities or options when it comes to a patient coming in and being referred for another specialty. So, yeah, education can go a long way of making your patients feel more comfortable. So, while I was doing a little bit of research about you, I mean, you're all over the place. You're working at so many different sites within our Northwell Health system. You're also a vice president, you're a professor, you're a surgeon. You're so embedded in the field of Northwell. I'm sure that there are major challenges just as a physician working in this matrix of a system. Can you share with us, what has been difficult for you to face as a physician in the health system?
Yeah, Sharon, before I answer that, I'm gonna basically, one thing I'd like to comment. Sometimes patients will ask, they'll say, you do a lot. How can you do a lot? Like, where do you make sacrifice? What do you do? And so I feel very fortunate that I found what I love and what I'm good at. And to anybody who's listening out there, is that we all have a natural skill set that we can excel at. And, some of us find it, some of us don't. If you ask me, though, is that you can't be good at everything, right? So if I can't throw a football, I suck at sports. I was the last kid picked on a team, right? I'm like tone deaf, there's a
Mhm.
lot of things, right? But
You
this is
found your
what I'm good
calling.
at. Right. I found my calling. So, I think that that's the key, is really to be able to focus in on what you love and what you're passionate about. An organization like Northwell is incredible because it really has put together the experts in any discipline or
Mhm.
any area of interest. And to a patient or to another clinician, that same benefit and opportunity can be a source of frustration and challenge, because we don't know
Yeah.
where to go and what to do. And that can be the challenge, is how do you navigate that? How do you find that expert for that particular area? And it could be a clinical thing that you need, or it could be like, hey, I want to create this IT application, an app for my patient. And you have the best of intentions to do it for your patients and their outcomes and for these women. But if you can't find who that perfect person is, you're going to quit. And nor should we expect. That's like me going out and throwing a football with Tom Brady. That's like, not, nobody wants to see that. That's not my thing, right? So I don't want to be developing an app. I want to work collaboratively. And that's the beauty of Northwell, is there are experts in every domain, clinical and non-clinical. It's just a matter of finding out who that perfect person is. And those opportunities are what allow for incredible collaboration and advancement.
Hmm. Yeah, no, it definitely exists. It's just a matter of connecting those dots to get there.
And I think that's where the Katz Institute for Women's Health does a great job. We talk about patient education, but it's also about outlining all of the resources that are available to both patients and Katz members in an organized way, in a way that makes sense. So it's not overwhelming. And so, like, hey, this is, if I have this issue or I have this concern, this is where I go.
Yeah, so we do have a resource number that patients can call, and it helps them navigate, them to the appropriate specialist, as you've said. So this is one of my favorite parts of our segment, where we just do this like rapid fire to get to
All
know
right.
Dr. Tanna on another level.
All right.
So
This is
just
the
please,
most nerve-wracking part.
yeah,
This is the part I get nervous on. All right.
just share the first thing that comes to mind. Again, I'm sure as a surgeon, high stressed environment, what is your best way to mellow out and just chill?
TV or movies. I love mindless shows, mindless things. Like, I obsessed with streaming. It's the best way to mellow out. And if you're a patient, I'll ask you sometimes when you're recovering, be like, hey, give me some good show suggestions. Or if Sharon, you and I are talking about something, I'll be like, what should I watch? So TV and movies.
Okay, any one show that you're currently watching
All right.
or new?
So we're being truthful here. So I would say that, I'm watching two shows right now: Love Is Blind,
Okay.
and uh, and this show on Hulu, Shogun. Right, so a Japanese show that has high ratings. So I'm watching two things. But again, what we do is so intensive that sometimes I want to watch something that is so mindless
I get it.
because it's just I can just shut it off.
Yeah. You don't want to think anymore.
Exactly.
Yeah, I'm sure we've all been there. Favorite season?
Favorite season is gonna be tied between spring and fall, but I'm gonna go with spring as a leading number one. If you force me to pick one, I'm gonna go with spring. Spring
Okay.
is, you're out of the winter. Yeah, there's a
Yeah.
little bit of pollen, but the summer's gonna come. It's just
Just around the corner.
optimism, right?
Mhm.
Optimism, glasses half full. It's
Yeah.
just it's beautiful, like spring.
Yeah. Okay. Birds are chirping, days are
Yes.
longer, sun is out. All right. I like that. So something that brings a smile to your face besides the season of spring.
Yeah, my children, especially my little guy, he's 6, and so he's at that age that he just surprises me. He'll say things that are so insightful, and then he'll turn around and say the dumbest things, and it makes me smile. It makes me laugh. So that's probably the number one thing.
Yeah. Life's little pleasures. And
Yeah.
I guess my last question is your favorite hospital or surgery center that you work at Northwell, but I don't want to put you on the spot for that one.
Oh, that's not even, you don't have to. Everyone who knows me well enough. There's no question. I am 100% pro for Glen Cove Hospital. It is an incredible place. And so you can ask me that 10 times out of 10 in front of anybody, and I'll say I love, big heart, big love to Glen Cove Hospital. And, I'm only one person on that team. There's an entire team there. And to all of the clinicians and all of the caretakers and every single person that works there, for any of you that are out there, you'll see what I mean. It's a culture unto itself. It's an incredible place.
Yeah, I'm sure all hospitals have their own personal charm. So
Exactly. So
it's great. Well, listen, this was wonderful. I had a lot of fun with you just learning the personal life, the surgical life. I'm going to have to take some of those shows that you just shared with us and then start streaming them. But also just wanted to take this opportunity. I know you've been a very active member with the Katz Institute for Women's Health. So thank you for all your contributions. Thank you for all the innovations. Thank you for reviving and giving all of our patients a second chance to life. And any closing statements that you'd like to make?
I think the Katz Institute for Women's Health is very near and dear to me, like you, and to many of those who are listening. It's an incredible organization, right? It really has the patient's best interests at heart, and it helps patients navigate a complex healthcare landscape, and it helps clinicians, and it really is the ground where everyone comes together. And so I hope that other disciplines look at it as a model, because it really has made things easier for patients and for clinicians. And I think many of my patients would say the same. So big thank you on behalf of my patients and for me professionally to the Katz Institute for Women's Health.
Okay, beautifully said. Thank you.
Yeah, I
And
gave you that sound bite at the end there.
we'll use it again. Thank you to all of our viewers for tuning in, and we hope to see you at our next Katz Conversations. Thank you.
Thank you.